Jordan is a 7-year-old boy who is in public school who has decreased fine and gross motor skills such as grip strength, hand-eye coordination, bilateral coordination, crossing midline, and has a lack of ability to alternate from his left to his right hand. Jordan receives occupational therapy 2 times a week for 45-minute sessions in a sensory gym. Jordan has a normal cognition level appropriate for his age, and he is diagnosed with a very mild, localized form of cerebral palsy in his right hand. Cerebral palsy primarily affects body movements, muscle coordination. Cerebral palsy is a developmental disorder that affects fine and gross motor skills. It is important for children to receive early treatment for cerebral palsy because of the developing brain and body are more resilient. Children that receive occupational therapy greatly benefit in being independent in ADLs as an adult. I chose motor control as one of my frames of references because of Jordan's difficulties with his force modulation, gross and fine motor control, and his delay in carrying out symmetrical movements. The second frame of reference I chose was developmental to help Jordan continue filling in the gap of education, modeling skills, and ADLs. The first assessment I chose was the BOT. Because Jordan has delayed bilateral coordination and difficulty with his fine motor and manual dexterity, I also chose the Berry VMI because of Jordan's lack of movement and his grip in his hand. My long-term goal is that Jordan will be able to grasp and manipulate objects with his non-dominant hand with 4 verbal cues while engaging in tabletop activities within 6 months. My first short-term goal is for Jordan to increase pincer grasp skills as evidenced by accurately picking up 7 out of 10 objects while using tongs within 3 months. My prep activity is Jordan will engage in a 3-part obstacle course to increase bilateral coordination, grip strength, visual motor, and hand-eye coordination. Jordan will begin with crawling through a tunnel and then will be picking up 2 balls and throwing them into a basket, and then he will lay prone on a skateboard and pull himself to the end of a rope like a pulley system. Jordan will repeat the obstacle course 3 times. The functional activity is Jordan will use a pair of tongs to take objects of his interest out of a tub of water. After he has the objects, he will have to cross the midline by placing the objects into a smaller tub. This will work on crossing the midline, hand-eye coordination, grip strength, and dexterity. An upgrade for this activity is to use smaller tongs or use smaller objects inside of the water. A downgrade would be to use larger tongs or bigger objects, or for him to even use his hands. The second short-term goal is Jordan will increase his fine motor skills as evidenced by grasping and releasing 7 out of 10 objects within 3 months. The prep activity is Jordan will work on his grip strength, bilateral coordination, hand-eye coordination, and dexterity while pouring water into a pitcher and using a syringe to fill up the spaces in an icebox tray. As Jordan pours the water into the tray, there will be food coloring inside of the tray already, so as he fills up the water, it'll change color. An upgrade for this activity would be to use a syringe that has a larger head so that it is more difficult for him to squeeze. A downgrade would be to use a syringe that has a smaller head so it'll be easier for him to squeeze. The progress note is Jordan started his session with a gross motor obstacle course, which worked on his bilateral coordination, hand-eye coordination, and core strength with minimal verbal cues. For task completion, Jordan was also able to perform a fine motor task to increase his pincer grasp while crossing midline to complete his activity. Okay, Mia, so today we're going to do a little bit of an obstacle course, okay? And you're going to start off with the tunnel. So you're going to go on the tunnel, you're on your hands and knees, you're going to do right over left, walk through the tunnel, and then you're going to get over to here, and you're going to throw the balls into the basket, like that. Alright, and then when you get over here, you're going to go on your belly, and you're going to pull the rope to get to the pole, okay? Right over left, all the way, alright? So you could start, go through the tunnel first. Keep your right hand flat, okay? Okay. Good job. Got it? Okay, I'll hold one for you. Use right hand. Good job. Ooh, all right. Go ahead, go on the skateboard. Got it? All right, start with your right hand. Okay, go ahead. Pull. Keep going. Don't cheat. There you go. All right, good job. Go through the tunnel again. Keep your right hand flat. Yeah. Okay. Good. Close. Nice. Good job. Slide this back. Careful. Got it? Okay. Right hand first. Go right over left. Go ahead. Good job. Keep going. Good job. That one was done really good. Go ahead. Go back through the tunnel. Thank you. Keep your right hand flat. Good job. Oh. Ooh, nice one. Good job. Go ahead. Okay, go ahead. Right over left. Start where you're right. Hold on. There you go. Good job. Very nice, Mia. All right, high five. All right, Mia. So today we're going to use the tongs, and we're going to take the objects, and we're going to pick them up, and we're going to throw them into the basket. Okay? Have to use your right hand, and let me know if it's too hard for you. Otherwise, we'll switch this one out. All right?
Okay.
All right. Try that out. Going for that one first. You can use your left hand. Hold on. Go ahead. Okay. Good job. How was school today?
Good.
Yeah? Did you have fun?
Yeah.
Ooh, you're doing really good with this. Good job. What did you do in school today?
I learned new math techniques.
Oh, yeah? Ooh, you're doing really good at this. I think we're going to make it a little bit harder. Good job. Got it?
I got it.
Keep trying. You're doing really good. Ooh. Going. One left. You can do it. Ooh. Good try. Keep going. Think about where you want to use it. Very good. Good job. All right, we're going to do it a few more times, okay? All right. Keep going. Nice. It's a cute little shell, isn't it? Yeah. Reminds me of the beach.
Reminds me of a tiger.
Of a tiger? Because it's striped?
red and black.
I love that little doggy too.
It looks
So-
like Butchie.
It does look like Butch, yes. Ooh, it's okay. Good job. Good job. Is that the last one? Yeah. That's the hard one for you, huh? You gotta think about where you're putting them. You do it. Did it before already, so you know you can do it. Try to do it like how you did it last. Hold on to your hand like this, because that helps. Try to flip it over and get the pedal like you did last time. Big one on the bottom.
It's not working.
Alright, don't worry. We're gonna do this one more time, okay?
Okay.
All right, go for it, girl. Good job. Good job. Try that flower. I know it's hard, but you can do it because you did it once already. You can do it. Open your hand more. Open your hand more. There you go. Good girl. Good job. Go on. Good job. One more. You see it? Perfect. Nice job. Perfect.